Welcome everyone, I'm Dr. Silva, and today I want to connect two areas that most people think are separate: bioidentical hormone therapy and orthobiologic regenerative medicine, like PRP and stem cells. When you understand how they work, you start to see they're not separate at all. They're part of the same healing conversation inside the body. First, let's talk about PRP and stem cells. These are orthobiologic treatments, meaning we use your own biology to drive repair. With PRP, we take blood, we concentrate the platelets, and we inject those platelets into a tendon, a ligament, a joint, whatever's injured. Platelets are loaded with growth factors, which act like signals. They tell your body, repair here, bring healing cells over there, build collagen, restore function. It's not a steroid. It's not masking symptoms. It's using your own signaling molecules to change the environment inside that damaged tissue. Stem cell-based treatments work in a similar manner. Whether using bone marrow or fat-derived stem cells, the main effect is often not that the cells turn into new cartilage. Actually, the benefit is that they release signaling factors. They help coordinate the healing and reduce the inflammation. They recruit other cells to repair the area. They help shift the tissue from breaking down into recovery. Now, here is the key point. Hormones work the same way. Hormones are also signaling molecules like testosterone, estrogen, progesterone, thyroid hormone, growth hormone, and cortisol. These are all messengers that tell your cells how to function, how to repair, how to regulate inflammation. This is why I consider bioidentical hormone therapy a type of regenerative medicine. If your hormones are low or imbalanced, your healing capacity drops. Your collagen synthesis also drops. Your muscle recovery drops for sure. Your bone mineral density can drop. Your tendons and ligaments become more injury prone. Your sleep becomes lighter and less restorative. Your pain is more sensitive and it increases overall. And inflammation becomes harder to regulate. For example, testosterone is a strongly anabolic hormone. It supports lean body muscle, tendon integrity, collagen production, and recovery after training or injury. Growth hormone and IGF-1 play major roles in tissue repair, cartilage metabolism, and recovery. Estrogen has major effects on joint lubrication, connective tissue resilience, and inflammatory signaling. Progesterone also influences neurologic stability, sleep quality, and inflammation. We restore hormones using bioidentical therapy. We are not only treating fatigue, libido, or mood. We are improving the internal environment that determines whether your body can heal. This becomes even more important when we combine hormone optimization with orthobiologic procedures. PRP or stem cells are local regenerative signals. Hormone balance is a systemic regenerative signal. If your systemic biology is underpowered, you are fighting uphill, even with good injections. But if your hormones are optimized, your body is more responsive, your recovery is faster, your supporting muscles stabilize the joints better, and you often get more durable results. So here's the bottom line. PRP, stem cells, and bioidentical hormones speak the same biological language. They all work through signaling, inflammation, regulation, and tissue repair pathways. When we combine them thoughtfully, we are not chasing symptoms. We are upgrading the body's ability to regenerate. If you want to learn more about how these therapies fit together in a long-term orthopedic and performance plan, stay tuned, because the goal is not temporary relief. The goal is lasting recovery by supporting how the body was designed to heal. Hey, it's Dr. Silva here with Interventional Orthopedics of Washington. If you found this video helpful, please comment and like and subscribe, and I'll try to get to those questions at the next video. Thanks for watching, and see you next time.